Hi everybody, Dr. Max here. I'm hoping everybody can hear me. All right, good. I think everybody can hear me now. So, like I said, I'm Dr. Max. Today's topic, yes, I'm in the exercise rehab room for this one, is that we're going to talk about how you can utilize DNS in real life. Because if you followed my video from last week, what you got from that is DNS basically is the idea of going from being immobile and uncoordinated to being upright and coordinated. Said in plain English, it is the act of learning how, it's the study and application of learning how to move through how we learned how to move in the first place, relearning that because of injuries or bad habits to help deal with chronic pain. So what I'm going to talk about today is stability. Now, the most important thing to note with stability is that stability starts in your core, quite literally. Now, a lot of people have been taught for a very long time that the best way to have core stability is to suck your gut in. DNS and Kolash and I can't think of the guy's name right now, but a lot of very smart Czech physiotherapists whose work is the inspiration for dynamic neuromuscular stabilization have found that is not true. The biggest reason why is because how many times do you see a baby sucking its gut in order to be able to hold itself upright or to help with doing any kind of moves it's doing? The answer is very rarely, because you can never say never, but almost never do you see a baby sucking its gut in order to be able to move better. Yet we all learned how to do that by the time we were about like 5 or 6, simply because of just, societal cues. But the point being is that if you want to have proper bracing and you want to have a good, effective core stabilization pattern, then the best thing you could do, push that tummy out. This is something that power lifters have found for a very long time. Not necessarily show lifters, but power lifters. Anytime you want to pick up something super heavy, everybody's got their belly braced, their abdomen braced. The technical term is canister bracing. And then that's the best way to generate power, best way to generate effective stability. Now, how do I apply that in my everyday life? Well, I'm glad you asked. The best way is to practice it. And I'm going to show you guys how to do that today, right here in a little bit. Alrighty. Let's get the camera positioned. Okay. Alrighty. So, what we do here, again, you see my belly right here is, yes, I'm a little overweight, but the biggest thing is that I'm able to develop an effective canister brace. Now, what I do here, what I teach all of my patients, and what I'm going to show you here is that you need to practice belly breathing and then practice abdominal bracing. You start with this, laying down, then you work your way to sitting up, then you work your way to standing. The reason why is because laying on your back is the least complicated. You can see that from right here, where this is the 3-month developmental position. And plus, any of you who are parents who are on this will know that baby almost always wants to be laying down. Very rarely does baby come out of the womb saying, "Hey mom, hey dad, I'm just sitting up here like this." No, this is a learned behavior. So to help you go through this, you want to also lay on your back. Again, arms and legs flat like so, and then you just work on breathing. Now you see how my abdomen rises and falls. And practicing is literally just that. You put your hands on your sides, or one hand on your chest, one hand on your belly, and you breathe. Let your belly rise, let your hand rise too when you take a deep breath. But the primary motion should come from the belly. Belly should start the movement. Then chest rises after, chest collapses, belly comes in. Same thing with the sides. Because I want to make it very clear that the point of this is not that you're going to only breathe from your abdomen. That's also a problem too. Just like only breathing from your chest is a problem. That's called paradoxical breathing. Both of those forms are paradoxical breathing. The goal with DNS and with any effective movement pattern is to have canister breathing, which is where all aspects of this abdominal canister, front, sides, back, top, bottom, are all engaged in the act of breathing, an act of stabilizing. The biggest reason why that's super important is because if you don't have this well established, then all of the rest of your muscles are going to have to work to try to do that. And when they do that, and when you're trying to use muscles that aren't well designed to do that, that's when you get a lot of the chronic pain issues. A lot of examples are people get super tight right up in here because your scalenes, which is the muscles that are right up here in the front, can get used as secondary muscles of respiration, i.e. they're the backup muscles to help you with breathing. The main one's the diaphragm, right here. What's supposed to happen is diaphragm is supposed to go down and then up to help pull the lungs down. But when we constantly suck our tummy in, we breathe like that. You do that, 10,000 times a day, and these muscles that are designed to be backups whenever you're doing super intense cardio work are going to get super, super, super tired and super tight because your brain's going to say, well, I really don't like working this hard all the time for these muscles that aren't supposed to do this, so I'm just going to go ahead and shorten them to make my job easier. That's where you get a lot of people who have your head slouched forward, and then typically your wife, because it's mostly guys that I hear it from, or even your husband will say, sit up straighter. But you can't, because otherwise then you won't be able to breathe. So that's one of the reasons why abdominal bracing is super important. Now, let's talk about it as it relates to going ahead and lifting yourself, and we'll start with bodyweight lifts. So, now, if you're somebody who's reasonably fit, like I'd say I am. I'm not, the pinnacle of athleticism that I used to be back when I swam, but, I'm not too shabby either. And you wanted to do something like, I don't want to show off here, but let's say doing a push-up or even starting with weightlifting. I'll be right back. Saying like you wanted to do a kettlebell curl or everybody's favorite kettlebell squat or a goblet squat. The purpose are to help make those go as easy as possible, core bracing, which that's the extent of what DNS principles would be able to apply as it relates from a simple standpoint for being able to help with exercising. Because when I want to go and do this kind of a motion, do a bicep curl into a press, I need to be able to have my shoulder effectively stabilized in order to be able to do that. Now, I can do something that looks like this to muscle my arm up, but if I do that a bunch of times, I think everybody can tell, now granted I'm exaggerating a little bit, but everybody can tell that I'd get a stiff back. If I did that enough times, and I wouldn't have a strong bicep, wouldn't have a strong shoulder girdle, which is what I'm looking to aim to do when I'm doing something like, say, a bent row. Now, DNS also focuses on the proper joint centration. this deals a lot with chronic, or this is where a lot of chronic pain, especially the patients that I see, plays a huge factor into it. Now, quick rundown is that you tend to have it where, say, like for me, say like I dislocated my shoulder, and then I got it to the point where it didn't hurt anymore, but every time I went to move it, it would click. Like especially, I did do this to my left elbow, my left shoulder, so I can show. Like say I wanted to go ahead, be lifting like this, but I have a little bit of a problem because of the fact that I had hurt my shoulder in the past. So I have issues right here. Like I get pain right in here, especially when I go to lift like this, or even with doing just a good old fashioned bicep curl. Now, how I can utilize DNS to help with something like that is, again, put myself in a developmental position, then work on putting myself in proper joint centration, which in English means all of the forces are acting on it exactly, and it's basically directly in the center of the socket. Warm up with rotating, like doing something like this. Again, belly breathing the whole time. And then, when I go to lift the second time, no pain, and better coordinated movement, which I hope everybody saw that, because that's important. Then there's, like I said, going to get up from sitting or just being able to get up from moving. Again, the way you utilize DNS principles is core stabilization and then utilizing developmental positions to be able to warm up literally for going ahead to stand up. And then, well, I guess we'll save that for another video because I'm coming up to the end of my time here. But I hope that this has been helpful. Again, my name is Dr. Max Gatzke. If you guys have any questions, leave a comment below whenever you watch this video. Or go ahead and shoot Regen Med a message, or I'm going to share this to my personal page, and you can shoot me a message there. If you're watching this on YouTube, leave a comment below, and I'll do my best to be able to answer you guys. This has been a great and very fun-filled DNS Live for me. I'll see you guys next week.